I'm from the Hudsons and Trinidad and Tobago, and I came up here when I was 17 for undergrad. So I've lived in a couple of different places in Atlanta and DC, Boston, New York, Oklahoma, and then I did my fellowship in Indianapolis. From Indianapolis, moved down to southern Georgia, and then moved back here to Indiana. When I was very young, I was involved in scouting and first aid. So sort of went a step from first aid and applying it to biology. I was always interested in how things work. So that got me into medical school, and when I was in medical school, the question was, what did I like to do? Well, I was always fond of working with my hands, and the first time I was in an operating room, it was a very novel experience, but I do enjoy operating, and that's the reason why I decided to become a general surgeon. Since I was trained in a community program, I do a lot more than just a basic academic surgery. For example, I do a little bit of the ENT work, especially the thyroids, the parathyroids, and among other things that I'm capable of doing. So the good thing about a community program is that you learn a lot about all the little bit stuff that other people do. So in fact, I trained with and did operate a lot with urologists, ENT surgeons, cardiac surgeons. So we did a lot of many different things. So I think that makes me a well-rounded surgeon in that aspect. Well, I've only been in Logansport for about 4 months. And so far it's been pretty impressive. The physicians here tend to talk to each other very much, and they tend to give each other a very good amount of healthy respect. That being said, there's a lot of camaraderie in the physician population here in Logansport, so it's very easy to meet a colleague and talk to them. That's not always the case in many of the larger communities of physicians that you go into. The patients here are actually very nice. They love to chat. I love to chat with my patients, so that's a plus for me, in that I try to tend to treat people as people. You're a patient, yes, but you're also there to meet someone and learn about them for a little while. Your health is your responsibility. We're just here to help. We're here to put you in a direction where you live a long and prosperous life. The only way we can do that is to have you helping us help you, if you understand what I mean. So, for example, I've had many patients. I tend to get people to get up and walking, because it's been shown that if you get up, start walking right after your operation, you do better. You get out of you get to the hospital soon, you get back home, you're able to do your own daily chores, able to start back doing things you love, and that's what I want. I want you back home doing the things you love doing. I don't want you in the hospital. I want you back home with your kids, with your dogs, back with your family. You can come see me in the office.